Bulimia nervosa is a really serious and often hidden eating disorder. It has these profound effects on both physical and mental health. So today we're going to do a clinical deep dive to really understand the cycle, the risks, and the path to recovery.
You know, this scenario, it really gets to the very heart of what someone with bulimia experiences. It's this powerful, really distressing cycle of compulsion and fear. So we're going to break down exactly what's happening from a clinical perspective to truly get a handle on this condition.
All right, so here's our game plan. First, we'll define the disorder and its core cycle. Then, we're going to explore the why, the underlying causes and risk factors. After that, we'll look at the clinical signs and some pretty serious complications. And finally, we'll wrap up with how it's diagnosed and treated today.
Okay, let's start with the absolute fundamentals. What exactly is bulimia nervosa? Well, the key to understanding it really lies in this pattern that we call the binge-purge cycle.
So here's the official clinical definition. You see, it's not just about overeating. It's a very specific pattern of recurrent binge eating, which is then followed by these compensatory behaviors. And here's a really crucial point, one that makes this disorder so tough to spot. Most patients actually maintain a normal or near normal body weight. They're hiding all this turmoil right below the surface.
Let's really break this cycle down into its two parts. First up, you've got the binge. Clinically, this is defined by two things: eating an amount of food that's objectively large, and critically, this profound feeling of totally losing control. That's followed by the compensatory behavior, what some people call the purge. This is really a desperate attempt to counteract the binge, and it's driven by this intense guilt and fear about gaining weight.
Now, for a clinical diagnosis, these behaviors have to meet some very specific criteria, which are laid out in the DSM-5. As you can see here, this cycle has to happen at least once a week for 3 straight months. And here's where we get to the psychological core of the disorder. A person's entire sense of self-worth becomes dangerously wrapped up in their body's shape and weight.
Okay, so that's the what. Now let's dig into the why. What causes bulimia? Well, it's complicated. It's really a mix of biology, psychology, and the social environment we live in.
First off, it's helpful to know that there are 2 main subtypes. The most common one is the purging type. This is what most people think of. It involves active methods like self-induced vomiting or misusing laxatives. But there's also a non-purging type, which is less common. This involves other behaviors like extreme fasting or compulsive excessive exercise to compensate.
And this is super important. There is no single cause for bulimia. From a neurobiological standpoint, we see links to abnormal serotonin regulation. Serotonin helps manage our mood, our impulse control, and even that feeling of fullness, so when it's out of whack, it can contribute to both depressive symptoms and that loss of control during a binge. Psychologically, things like low self-esteem and perfectionism can create this desperate need for control, which the binge-purge cycle can falsely seem to provide. And of course, we absolutely can't ignore the powerful sociocultural pressure from societal ideals that are constantly promoting thinness.
So, given that this condition is so often hidden, how can clinicians even begin to recognize it? Well, this section is all about the telltale physical signs and the very, very serious medical complications that can happen.
One of the classic physical findings we look for is something called Russell's sign. These are calluses or even scars that form on the knuckles or the back of the hand. They're caused by the repeated friction from the teeth during self-induced vomiting. Now, not everyone has it, but when you see it, it can be a really specific indicator.
And you know where else a huge clue can pop up? A dental exam. Repeated exposure to stomach acid causes this significant erosion of tooth enamel, which we call paramolysis. And the damage is most characteristically seen on the back surfaces of the upper teeth. That's the area that's most directly in the path of all that gastric acid.
Another visible sign is swelling in the cheeks. This is because of parotid gland enlargement, or sialadenosis. It's basically the body's response to the chronic irritation from vomiting. For a clinician, these 3 signs together, Russell's sign, that dental erosion, and parotid swelling, they form a classic triad that should raise a really strong suspicion.
And the need for recognition is urgent because the complications are severe. We're talking about dangerous electrolyte imbalances, life-threatening heart rhythm problems, damage to the esophagus like something called a Mallory-Weiss tear, and of course, severe dental decay. This is a medically serious condition, no question about it.
Of all those complications, I want to zero in on one in particular: hypokalemia. That's dangerously low potassium levels. It's a direct result of purging, which causes a huge loss of gastric acid. Your kidneys try to compensate for that, but in the process, they end up excreting massive amounts of potassium. And this low potassium is the #1 driver behind the risk of fatal cardiac arrhythmias, which makes this a true medical emergency.
So how do we confirm a diagnosis? And most importantly, how do we help patients get on the path to recovery? Let's take a look at the modern, multidisciplinary approach to treatment.
All right, so the diagnosis itself relies heavily on a really thorough and compassionate patient history. Because there's so much shame and secrecy involved, creating a non-judgmental space is absolutely critical to help someone feel safe enough to disclose what's going on. It's also important to note that lab tests like checking electrolytes and doing an ECG, they aren't used to diagnose bulimia itself. They're used to screen for those dangerous medical complications we just talked about. When it comes to treatment, the gold standard is a team approach. First, you have psychotherapy, especially cognitive behavioral therapy, or CBT. It's highly effective at helping patients identify and change those harmful thought patterns that are driving the cycle. Second, there's medication, specifically the SSRI fluoxetine, which has been proven to help reduce binge-purge behaviors. And third, nutritional counseling is absolutely essential to help someone rebuild a healthy and sustainable relationship with food.
So, to pull it all together, bulimia is a serious disorder defined by that binge-purge cycle. It's marked by key clinical signs and carries life-threatening risks. But, and this is the important part, it is treatable. The key takeaway here is that early recognition and treatment can significantly, truly improve outcomes and make all the difference for long-term recovery.
And that leaves us with one final and, I think, crucial question to think about. The clinical facts are vital, for sure, but recovery often begins in that single moment when a person feels safe enough to just speak up. So what role can we all play, as clinicians, as family, or as friends, in fostering that safety and encouraging someone to take that first incredibly brave step? It's something really important for all of us to consider. Thanks for watching.